The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. If you wait, it may be late. To my military family, I got your six. To my Masonic brothers, the light is bright. Please welcome my co-host, Sammy Vanny.
Hi, everyone.
How are you today?
I'm good. Just tired.
Just tired?
It's cold out again. I don't like it.
No.
Nope.
The sun came out, it started warming up, and then we had that cold wave that came through.
I had such a boost of energy, and now it's just gone.
Yeah, I hear you. All right, so I screwed up. Okay, so the last few weeks have been really, really tired, just emotionally draining. We had a lot on. My family went through a lot, and I totally forgot. Last Wednesday was my anniversary with my wife, and she heard the show, and she goes, "You give me a shout out all the time." I said, "But you didn't shout out our anniversary." So, yeah, so I got it. How
good. How much trouble were you in, and how much did you have to make up for it?
I'm still making up for it.
She's going to hold that against you for the rest of your life.
That's it. So, baby cakes, happy anniversary 1 week late. So,
happy anniversary.
There you go. Yeah, it's, I'm very lucky and fortunate. She's my best friend, someone I can really count on. And my weaknesses are her strengths. And my strengths are her weaknesses, and this is where we balance each other out. I always say I'm the dreamer, and she's the realist. She grounds me. When I start to get out there, she pulls me right back in. Reality check. So again, happy anniversary, baby cakes. I love you. All right.
Alrighty, so for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with a personalized adjustment treatment plan for all just $49, normally a $250 total value. This is a limited time offer as we have had a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
All right, so before we get into today's show, how's school going?
School's been good. It's been good. My internship class, I have to write a little journal about all of this, so I'll have something to do tonight after tonight.
Yeah, it's pretty exciting.
It is exciting. I like it, and I like writing about it.
Yeah.
We had to talk about in class what we wanted to do, and I was confused, but this was in mind, definitely.
That's good. Yeah. Well, it's a new experience, and this might be an opportunity for you, to enter in a career. You need the exposure.
It definitely opened my eyes to a lot, so I have a lot to think about now. And now I'm really confused.
Well, you got to find out what's your passion. For me, science came easy to me, and my passion, I love helping people. And, you combine science and helping, and there's health right there, and medicine. Because medicine, the medical field, that's a very, very broad term. And for me, becoming a physician, I was very fortunate to, I applied and was accepted into osteopathic medical school. And, that was going to be 33 years ago. I can't believe over three decades. Wow. Yeah. And, I made a promise that I'd give back to the community, if I made it through. And I've been giving back ever since. Always want to thank the Lord. I said, if you help me, and I'm going to help others and make a difference in the community. And here I am, three decades later. Yeah, exactly. All right. So today's show, we're going to talk about degenerative disc disease.
What is intervertebral disc?
Yes, intervertebral.
Intervertebral. Oh, no. Oh, no.
That's good. Yep. So, okay, that is the disc in between the vertebrae. Okay, what is a disc? A disc is a cushion. And I want you to just visualize, okay, what a powder-covered donut, okay, with the jelly, a jelly-filled powdered covered donut, okay? A nice fresh one that comes out of the oven. It's round, it's nice and equal in density and in shape, okay? That would be a disc. And the function of the disc is one, so you don't have bone on bone, okay? So the bones don't rub, but it also allows the bone to have a three-dimensional plane of motion. So you have flexion, extension, rotation right, rotation left, side bend right, side bend left. And that's what the disc does. It gives us that freedom of motion.
Right now, I'm just picturing a donut.
Yeah,
I'm hungry. What is degenerative disc disease?
Yes. Okay. Well, again, what I just described, the disc itself, the disc starts to deteriorate and it starts to break down. Again, you look at the disc, it's nice and fresh. It's round and oval in this case, and has the jelly that's inside of it. And as we age, we can see a deterioration of that disc. And there's all different reasons, causes for discs to become degenerative, where it starts to break down. But basically, that's what degenerative disc disease is. It's just a disc breaking down.
Who may develop degenerative disc disease?
Yes. Well, let's talk about risk. In life, we always speak about risks. The more risks you have, there's an increased chance of developing some sort of pathology. In this case, for developing degenerative disc disease, smokers have a higher risk. Physical demanding jobs. If you're constantly doing lifting, bending over, or lifting in a flex position without bending your knees, that definitely is going to cause it. That's why we need occupational therapy. And when you go in for those types of professions, they will teach you how to lift properly, okay, the dynamics. Then also physical sports, okay? When you get into like football or any sports where there's physical sports, contact sports, you increase risk for developing degenerative disc disease. Aging, okay? As we get older, we're all going to have degenerative disc disease because we have what's called dehydration, and then the disc starts to dry out. Doesn't matter who you are. To some degree, we will all have it. That's why when you look at seniors, I'm talking about 7th, 8th, 9th decade, you see how short they are. And that's because the discs are starting to dehydrate, and we can lose several inches in our height. The next, genetics, okay? Genetics play a role. You can't pick your parents. So if you have the genetics to develop a medical condition, you're going to have it. We can try to decrease the risk by eating healthy and exercising, but with the genetics, no matter what you do, that's that. Again, like I said, injury, obesity, and especially morbid obesity, because you have that increased weight on the musculoskeletal system, and there's going to be more demand, and they're going to wear out. You can have other issues, okay?
I just have one thing. Thank God I don't play sports.
You don't play sports? Well, you got the gym. You work out. Okay.
All right. Next question. What are symptoms of degenerative disc disease?
Yes. Pretty simple. Pain. Okay. And there's all types of pain. You have dull, achy pain versus sharp pins and needle, like a neuropathic type pain. And then you have what's called radicular pain, and that's pain that radiates down from one area, the point of origin, somewhere distal, okay? Let's say you have degenerative disc disease in the cervical spine, in the neck, okay? And that could be due to like a disc bulge or a disc herniation, and then the pain radiates down into the arms and into the fingertips. And based on the dermatome, okay, that's the level, we can determine the level where the disc, we have degenerative disc disease. The thumb, we're looking at 6, C6, the middle finger, C7, and the pinky, C8. So we know exactly what dermatome. And same thing in the shoulder, or what we call the deltoid, and bicep and tricep. So if we're having issues there, when we know what level of the cervical spine that's injured. All right, so we have 36 seconds. Wow, that's how quick this went already. All right, so to learn more about my practice, you're going to go to drtommyo.com. That's drtommyo.com, or give my office a call. That's 631-980-8200, 631-980-8200. I am accepting patients. If you're involved in a motor vehicle accident, call my office. You're going to get that care. You heard Ken, right? Allback. He is a PI attorney. I want to thank him for being on my show last week. If you have any injuries, neck, low back pain, give my office a call. Welcome back to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your health care needs. If you wait, it may be too late. All right, so I want to welcome everyone to my co-host, Sammy Vanny.
Hi, guys. We're back.
We're back. That's it. So, again, I want to make sure this is nice and clear. I want to wish my wife happy anniversary, baby.
Now you got to do it twice just for her.
That's right. She deserves it. All right, so you were talking about, about school and how well you're doing. And how much more time do you have about?
So I should be graduating this year,
okay,
but I think I'm going to extend it. Mm-hmm. My mom's going to kill me, but I think I'm going to extend it. I really want to get like a grasp on what I want to do more. So I feel like to do that, I have to take a few more classes just to like broaden my horizons a little bit.
Okay.
So we'll see. I haven't decided anything yet, but we'll see.
All right. You're going to Molloy University?
Yes, I am.
There you go. That's a great school. I mean, they're known for, the school itself is known for its nursing program. It's a leader in the nation. All right.
So for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with the personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we have had a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
That's good. All right, so let's just a quick summation. I was talking today's show is about degenerative disc disease, and we discussed what an intervertebral disc is. Again, all I want you to do is visualize a frosted, well, not a frosted, but a powdered covered jelly donut. Okay, and that's what a healthy disc is. And the function of the disc is to, it's a cushion. Okay, so it's in between the bones, and so that we don't have bone on bone. Okay, you know, people know about bone on bone. They go to the doctor and they're saying, okay, you're eventually going to need a hip replacement or a knee replacement because you have bone on bone. Well, what the disc is, it's a cushion, so it prevents bone on bone rubbing. It also gives the spine the ability to move in 3 dimensions. Okay, so you have we have flexion, anterior, posterior, going backwards, what we call extension, rotation right, rotation left, side bent right, and side bent left, and this allows us to move. All right, because if we didn't have that ability, we would just stand straight. And each segment just moves a little bit. And if we have a little movement in each segment, okay, we have a large movement overall. And then, like I said, that is the function. Then we went into what is degenerative disc disease. And basically, it is the breakdown of that jelly-filled donut, okay? And we'll get into specifically, and I'll talk about that right now. So we'll talk about disc bulge versus a disc herniation. Okay, and this is degenerative disc disease, and typically you'll see that with trauma. You could be born with that, and there's probably a large percentage of the population that's walking around right now that has disc bulges and disc herniations, but they're asymptomatic, meaning they do not have any pain, no symptoms, and they're living a relatively normal life. So what is a disc bulge? Just imagine that donut. It's fresh, okay? It's right out of the oven, and that's a normal disc. Now, within the donut itself, it has a jelly, okay? And that's what we call the nucleus pulpus. It's jelly filled, and that gives it that little cushy movement. On the outside, we have a fibrous bands, and that keeps the shape, so it stays like oval, okay? Now, when we damage the fibrous bands, then I always say, okay, structure is function. Without proper structure, there is no function. So what happens here is that we have change in the structure, and then function starts to change. So if we damage those fibrous bands within that donut, just imagine there's fibrous bands within that donut. And if we damage those bands, and then the shape of the donut changes, when we change the shape of the donut, then the disc space decreases, and we can pinch the nerves, okay? And that's what we call impinged nerves. So if it just oozes, let's say the jelly itself oozes a little bit and changes the shape just a little bit, that'd be a disc bulge. Then we have the herniation, okay? Now you have a really serious change, and that's that ugly donut that no one wants in the corner, and it's, I'll take it, I'm hungry. The one that's flat and really the jelly's just oozing out. So that's, again, structure is function. So then we have those fibrous bands there, really damaged. And then you have that jelly really shifts. And then the part of the disc itself can actually touch the nerve root, or it even can touch the spine itself. And that's where you start to get the radicular pain, or you get paresthesia, okay? You have that burning sensation, a tingling sensation, or lack of sensation, depending on the dermatome of the area of the body. So if it's in the neck, you could have that down into your arms, into your fingertips. If you're in your lower back, okay, if it's in your upper, let's say you have your lumbar spine, 1, 2, and 3, that'd be your lateral thigh. If it's L4, 5, or S1, that would be a sciatic nerve, and that's sciatica, and that's the radiation that goes down through your cheek, down into your legs. And that would be a disc herniation.
Okay. How is degenerative disc disease diagnosed?
Okay. Well, first you want to do a thorough history and physical. Okay. Always start off with a thorough history and physical. On a physical examination, I'm looking for muscular atrophy. Okay. So I'm looking at the tissue, and I want to see if there's any tissue changes. Now, what is atrophy? That is the breakdown, okay, where it starts to shrink or get smaller, all right? Now, muscles have nerves. Well, the nerves innervate the muscle. Let me correct that so you understand. Nerves innervate the muscle, and there's always a baseline of nerve signal, nerve impulse to the muscle, and that maintains the size. Okay. Now, if we decrease, and then when you work out, we're really stimulating the muscle and stimulating the nerve, and then you have hypertrophy, and it starts to grow, right? With the bodybuilders. Now, if we change that nerve signal and we change that baseline, okay, and we slow it down, okay, or we have lack of that nerve impulse, then the muscle starts to deteriorate and starts to get smaller. So what I do is I'll look at the body to see if there's any atrophy, and then I know that there's problems with the nerve. The next, we could do x-rays. And then x-rays will just show us, x-rays aren't designed for soft tissue, but we'll look at the bone and I'll see the bone space is decreased and you have an idea of what's going on. CTs and MRIs. Ultimately, I love MRIs, and they're going to show you excellent for soft tissue, especially if you have the supercoils. Very, very, very detailed. And you're going to be able to see all the soft tissue. You'll see the space and even subtle fractures in the bone. And then you could do a nerve conduction test, and that's sending a signal down. If there's a change in that nerve in that path, then we know that there's a problem. That's what the nerve conduction study is.
Okay, how is degenerative disc disease treated?
Okay, all right, that's a good question there. Well, it all depends on the severity and how, the cause and the severity of the condition itself. We can take a very conservative approach, and that would be, just weight loss, okay, diet modification, weight loss. What you'd want to do is strengthen the core muscles, physical therapy, chiropractic, or osteopathic adjusting. Then you have medications, anything from medical marijuana to nonsteroidal anti-inflammatories. You have muscle relaxers, and then you have analgesics. And analgesics could be something like a Tylenol, or you can go really as high and as strong as like narcotics. And again, you're getting into the last resort there. Also, steroid injections, and then the actual last resort would be surgical intervention. All right, so we're down to the last 50 seconds. Okay. You want to say anything?
No, this is interesting. I honestly, I didn't even know how to pronounce the word, so knowing what it is even cooler.
Yeah, it's when you're dealing with Latin-based terms, it's tough. We all go through this when you're learning, and then you say it slow. You take your time.
This is why I didn't become a nurse. Sorry, Mom.
All right. All right, to learn more about my practice, go to drtomio.com. That's drtomio.com, or give my office a call, 631-980-8200, 631-980-8200. If you're involved in a motor vehicle accident, I am accepting patients, no fault, okay? That's what it's called, no fault insurance, car insurance. That no fault covers your treatments. All right. Accepting patients, give me a call.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.